Americans approach retirement, one common concern is understanding Medicare and what exactly it provides. In the sponsored segment this morning, McIntosh, founder and CEO of McIntosh Associates out of Freeland, joins us live to talk about common Medicare questions. Good morning.
Good morning. Thanks for having me.
Yes, thanks for your time. Great to see you. First off, in the most basic terms, explain Medicare for us, what it is and who exactly is eligible.
You bet. So Medicare is going to depend a little bit on timelines and how many years young we are. We like to talk about it here in our focus plan. But really what happens is we go back to school and we learn a little bit about the alphabet soup. So Medicare Part A is really going to be your hospital portion of your benefits. Most folks, if you've worked enough amount of credits, qualify to not have to pay a cost of Medicare Part A. You paid for it or you're paying for it during your working years. And this covers most of inpatient hospital stays. The timeline to elect that is, generally speaking, for most folks, a timeline around 65. So we usually like to have folks, and we help them with every step of the way to get enrolled in this about 3 months ahead of their 65th birthday. But of course, there's timelines when people are eligible of either having a disability or at a younger age due to something of that was unforeseen. Otherwise, this is generally speaking when we help our folks through our customized boutique here enroll in that Medicare Part A. Now, there's also certain timelines that we actually don't enroll in Part A. These are other things that are more custom designed with our folks that we meet with here virtually or across from the table. If you have health savings accounts or HSAs and employer plan, we usually wait. So that's one caveat with Part A for a tip. Medicare Part B is going to be more of your outpatient benefits. You do have to elect Medicare Part B if you are not drawing Social Security. So that's a whole nother part of our plan to talk about income planning as we get close and be in retirement. With that retirement made clear and your focus on healthcare, we have to help you to know when and how to apply for Part B and why we'd apply or why we would wait. And when is it automatically instilling to have that 80% coverage for outpatient visits and doctors and specialists. So that is the fundamentals of that red, white, and blue card. As you can see, it's confusing of the timelines and who would and who wouldn't, which is why it's so important to have a specialist help you. I really can't say enough about that. We really like to talk about this in our event studio here in Freeland. We actually have coming up on May 16th at 6:30 an event where we talk about Medicare Simplified of getting the A's and B's set up. So once they have that red, white, and blue card, now it's actually time to instill which pathway of a plan do they want. Will they still have employer coverage? Do we need to help them with a supplemental plan or a Medigap to cover the items that Medicare isn't? Do we need to look at an Advantage plan or a Part C bundled plan altogether that offers you medical and prescription and dental and vision and hearing in one package? If we do that, there's exploration we need to do with your Part D medicines and prescription drugs to enable and make sure that you understand. On a nice screen, we try to make it really easy. We framework out all the step-by-step processes for you. We load and take a look at all your prescriptions, your formularies, the pharmacies, the doctors that you see, so that we can really custom design how that plan is going to work for you. And then making sure that we're always reviewing that every year.
Yes.
So what might be a great option now could be different as we see formularies change every year.
Yes, a lot to consider there, and you squeezed a lot in there, Mindy. Our thanks to Mindy McIntosh, founder and CEO of McIntosh Associates. Quickly, before we let you go, where can people find out more information?
Please go to our website at wealthmichigan.com. You can go ahead and register for upcoming events. Call our office here at 877-222-8849. And we hope to see you to make your retirement made clear and focus on this healthcare piece May 16th at 6:30.